Ladies and gentlemen, we wish to welcome each and every one of you on one of these many talks that we would be having on different issues of life that is pertaining to the Guyanese society. We have our pre-medical student starting from the extreme right. We have Mr. Adolphus, followed by Ms. Harris, Mr. David, Mr. Brad. Of course, we have our moderator, Ms. Emilia, and then our timekeeper, Ms. Shabana. Of course, this is your friendly host, John. So, the topic for today's discussion is suicide among the Guyanese society. So, as a first speaker, I wish to invite Ms. Harris to share her views. Yes, Ms. Harris, what are your views on suicide and your thoughts on that? Please give us.
Good morning, everyone. We will be looking at suicide as an overall issue, and as from this minute on, World Health Organization in Guyana has labeled Guyana as the highest suicidal rated country in the Caribbean. I work in hospital, and like every day or every 2 days we will be seeing suicidal attempt among teenagers, and the rate is about age 13 to 19. Only 2 nights ago we had suicide on a pharmacist and his wife, a doctor, who is right now critical in the hospital. And from his case, you could have seen that his suicidal attempt and his abuse come from family history. Studies of him show that his father used to beat his mother a lot, and very badly. And so he had this tendency of doing his wife the same thing, only that it get extremely so bad that he was so violent, attempt to take her life and his also. We look at some causes of suicide, and we say that this could be a death of a loved one or a divorce. We also say that the person can be mentally ill if they have hallucination and they're bipolar and these sort of mental condition, or if they hear people talking in their head, they made attempt on their life, or they try to take someone else's life. And suicidal is such a serious thing as if someone come and said to you, I'm going to go and kill my wife tonight, you need to go and report that person. Not only report, it would save the person who is making the attempt, it would save the life of the individual. That's how serious it is in Guyana today. Some other things we look at is loss of hope. You know, like when you feel that no one is there for you and the world is coming at the end and you have no place here anymore, you'll try to maybe harm yourself or drink poison. Some of the prevalent poisons that really is among Guyanese today that they normally use is this poison named Gramazole. This is such a deadly poison that it shut all the organs down internally. Lifespan of a person drinking this poison is 21 days. If you took a little card, you would be able to live like 18, 19 days. You took quarter bottle, your lifespan is like 3 days. You took a sip, 21 days, but definitely you will die because Gramazole, it shut all your organs down, it kills you internally. Some other causes we look at is drug abuse, alcohol abuse, rape, intense emotional pain, a terminal illness, a serious illness, horrible disappointment. All these things will lead to suicide.
So, Mr. Harris, I wish to interrupt you at this point.
Yes,
If someone would like to ask you to point out one particular indicator or one particular reason for people to resort to such means, such measures, what reason, what particular cause would you attribute that to?
Well, right now, from looking at cases in Guyana, we have a lot of domestic abuse that lead to suicide. And we also have teenager delinquency. Parents and teenagers, and they just go and drink Ramazon because their mother may not have enough money to buy this for them or these sort of things. So this is like two cases.
Have you come across any issues where just because they are deprived of these gadgets that students really or young people really go and resort to such extreme measures as in their lives in your medical career?
Oh yes, I only like 2 weeks ago I have dealt with like 3 teenagers who are only between the age of 13 to 16 who took their life with Gramazone because their family couldn't afford certain things.
Okay, I think we would now move on to the moderator's view on your particular take on this topic. Yes, moderator, would you like to shed some light?
Good morning once again. Ms. Harris, you point out some very important causes for suicide, but I'm wondering, in Guyana, we have many children, many teenagers who are feeling so despair. Any little thing would normally cause them to do that. Sometimes they have this thing where, like, we're thinking of drug, we're thinking of divorce, we're thinking of mental illness. All those are like major things. But what about when somebody fails an exam? What about when they have a broken, like when they have a relationship, boyfriend, girlfriend, this teenage puppy love kind of thing, and then they take a razor blade and they start cutting across their wrist, right? Because I have seen many pictures on Facebook with teenagers, blood right through, and the blade, the razor blade is down there. You have any thing to say on that?
Oh yes, because really we were looking at this suicidal thing that actually kills, right? But these things, these teenagers with these sort of thing, they're emotionally wrecked. There is one. And if peer pressure could be an next one because you've been preparing for this exam and then you come and you fail, your family would be disappointed in you and you just can't cope with this thing anymore. And that's why in Guyana here we should have a lot of counselors right now who could help these teenagers, counsel them even at school or go home at home, and you counsel them and you help them with a coping mechanism. Because there's one of the things that would affect them at this time, the coping mechanism. How can they handle this if they fail? If they have a broken relationship? If the mother and father lives in poverty and they can't afford these things? And so they do have cases like this. Like, for example, last week I came across a case where you had a teenager who was only 19 and she took tonic. 3 bottles of tonic because she feels like her father don't love her enough. You know, so all these are like emotionally stress that they go through at home, at school, with their friends. That's why we need a lot of counseling.
Okay. I think we will now ask Mr. Brad to shed his point on this particular topic. Yes, Mr. Brad.
Good morning, everybody. My topic was tying bullying into suicide. Bullying just aggravates the depression and increases the risk of suicide. So a person could already be on edge, and that bullying just gives them the push to commit suicide. Bullying is, there's 3 different kinds of bullying. There's physical bullying, there's emotional bullying, and cyberbullying. Physical bullying could be actually harming the person. Emotional is like giving the person insults every day. Or cyberbullying over Facebook, MySpace, social networks.
Okay, I will wait till you complete. I have a question.
Bullying from suicide is a third leading cause of death among young people. It's if 40% of high school students consider suicide from bullying, and about 7% actually attempt it. But bullying doesn't only include in the high school teenage settings. There's also bullying in the work environment, bullying like singling out individuals in the where you work or where you and your friends get together, just singling them out and making them feel lower than what you and your friends are.
Yeah, but Brad, don't you not think bullying is a form of initiation where juniors get to know seniors? Because in some cultures they really permit such bullying in institutions. I myself have witnessed when young people or people who are younger in age are encouraged to undergo such trauma. So what do you think about such cultures, or I should ask such institutions which promote openly bullying to be a form of coming into the pack?
I agree with you because in a way it gets you to realize what life is about, and life is not going to be easy your whole way. It trains you for life, but same time, not everyone can handle the bullying that you get to train.
Oh, okay. So what do you think we should do to stop this?
Well, the teachers and parents wouldn't really see you. See the bullying will take place, and the child or the young adult wouldn't really tell in fear that they might look weaker than their peers. So really, you have to have a good communication with the young adult.
Okay. Communication. Moderator, your take on this? Would you like to shed some light on this?
I would. Actually, Brad, you did a very good job on bullying, but I have a question for you and for anybody else who wants to give it input. What about bullying in the school or bullying on the streets because one is, let's say, physical, because of your physical outlook? Let's say you're gay, let's say you're fat, let's say people say you're ugly. I don't know how they define ugly and nice. I don't know who says one is pretty if they're not slim. You know, who decides that? But really, people are being bullied because of their physical component. So what's your take? Anyone? Brad? Anyone?
My take is that's how bullying started, is you being singled out for being abnormal from society. Like being gay or having a deformity with yourself will just single you out and target you for bullying.
Anybody else? Let's hear Murphy. David?
As in particular to that bullying.
Physical. Have you seen or have you witnessed or have you known any sort of this bullying because of one's physical being?
As far as I've seen sorts of bullying and stuff, I've never came across anyone being bullied in school. Well, obviously bullying in school takes place, yes, but I haven't seen that type of physical bullying which may cause individuals to commit suicide on themselves. But I know that
it does exist. Okay. So coming to David, what are your views on suicides?
Okay, as my colleague Harry said, that suicide, Guyana is ranked the fourth in the Caribbean and one of the highest ranking country in the Caribbean and South America. A state that has more risk of people committing suicide. I've came across some information that says that about 40% of the people that commit suicide in Guyana, these persons do commit suicide. They normally take agricultural pesticides to get rid of themselves, as they want to put it. My topic, or the task that I've been given to do, was depression. How can depression cause suicide? What is depression? Depression, a major depression, also known as clinical or unipolar depression, is one of the most common mental illnesses. And how can one be depressed, or how can that cause suicide? In cases of marriage, in cases of divorces, in cases of, according to them, they said that that issue of that issue with somebody or a person being given an exam and that person fails himself, that person may be depressed and try to commit suicide.
Okay. Yes, so we will now move to the final participant, Mr. Adolphus. What is your take on suicide, sir?
Good morning, everyone.
Good morning.
I'll be sharing on abuse. Abuse can be one of the causes of suicide. Not only here in Guyana, but internationally. Some of these abuse can either be domestic abuse, can be drug abuse, and when persons actually being abused, they are being affected psychologically and physically. And if you looked at some of the effect drug abuse may have on the individual, it may affect them in a health-wise. By one, they may have problems with their circulation of blood. They may have problems with their heart. They may have problems with their liver and their muscles. They may also have mental problems. And these problems may cause persons to commit suicide. For example, if somebody is hooked on cocaine, they may not have control over themselves. They may do anything possible to actually gain cocaine to use again. Persons who actually abuse cocaine or drug may put themselves at risk to have multiple sexual partners. Those persons may even harm individuals. So you can say that suicide drug abuse isn't only that they may harm themselves, but they may harm others as well, because you may not, if a person actually hooked on drugs, they may not have control over the way of how they think, and they will actually approach that individual and harm the individual. It can also contribute, drug abuse can also contribute to domestic abuse. And I think that because these people, they may have effects on the psychological part, they may do anything to commit suicide.
Okay. All right. Finally, I can give you all 1 minute to tell me, is it possible for us to get rid of this problem medically? Do you think it is possible to find a solution medically?
Well, to a certain extent, depends on the substance that they use. Because here we're looking
to prevent suicide.
Or to prevent suicide medically. Well, in a way, if the World Health want to do a campaign, they could do a countrywide campaign. They could hand out pamphlets and teaching and educating people on preventing suicide.
Okay. Okay. Yes, moderator.
Try to answer your question. I know if you go to a doctor and say if they see that you're somebody that thinks attempts suicide, normally what they would do, they would treat you for depression. They would give some pills, antidepressant pills and so on. After those pills are gone, but sometimes people are still on those pills and they still, after the pill works out, you're still depressed. So I don't know how medically we can try with that. I don't know how effective that method is.
And to add to what Ms. Amelia said, with these things, you also would refer the patient to the psyche. So there would be a doctor there who deals with the mind and who could counsel it. So in addition of medical being able to treat the suicidal case, You still got to get counseling and so on. Most times it may or may not work.
Okay, as a continual of your point that counseling, do you think we have sufficient support, both financially as well as in terms of educated counselors standing there to assist people who are in real immediate need? Do you think we have that support available? If yes, then how far are we into that? If no, what would you suggest to get such supports?
Well, looking from the country right now, we only have one doctor in Berbice working in mental health, and we have one in Georgetown working in mental health. We need more people. We don't have people who go after psyche patients or mental health. All we have is a lot of medical doctors who treat normal people. If you take a ratio, you're going to see that it happens in Guyana. So we need more counselors, more doctors who's going to dedicate their life in treating the mental health aspect of a person. And we need more. So the answer is no. The government of this country should implement right now, right, a budget as to how to train, to finance, and help people. Okay, ladies and gentlemen, thank you very much for. Would you like to have anything to say?
Sure.
Yeah.
With suicide, I think that every organization in Guyana needs to play their part in the reduction of suicide. You have the religious organizations, you have the government organizations. They should play an important role or part.
Okay, since you're talking about organization, let me just interject at this point. If a private agency which is internationally acclaimed, which is based in some top countries, would like to make an initiative in getting rid of this problem, would you be in a position to collaborate with them? Would you be willing to collaborate and deliver?
Yes, I will.
The answer would be yes.
Of course.
Okay, all right. I think yes.
So Ms. Harris's final point. Like if my memory serves me right, I'm remembering that the Ministry of Education had initially tried, right, to implement, to put at one social worker in each school, but it hasn't worked out. It hasn't. They tried. I can remember there was a point when they were trying to employ social worker for each school, but I don't think.
Okay. Brad, would you like to say anything? Add anything? Are you fine? Murphy? Okay. Thank you, ladies and gentlemen, for taking this invitation. On behalf of RGUST's research talk, I wish to extend my gratitude and thanks for this helpful, much useful discussion that would really do a lot of benefit to the society. Thank you.
Thank you.